Hi there, you're welcome to DemiRx Care channel where we talk about medications and how to use them properly. If this is your first time on our channel, make sure you hit the like and subscribe button down below. That way you're able to get alerts anytime we post our other educating videos and contents here on YouTube, as well as be able to support our community here at DemiRx Care. So what is our topic of choice today? Our topic today is called Hydralazine. So the brand name of Hydralazine is called Apresoline, and this medication is used in patients who have heart failure as well as hypertension. It can also be used in patients who have a pregnancy-induced hypertension. So this medication is usually taken as a 25 to about 50 milligram 3 times a day to 4 times a day. So patients will either take 25 milligram tablet either 3 times a day or 4 times a day, or patients will be on the 50 milligram either 3 times a day, like I said, or 4 times a day. And usually the maximum for this medication is 200 milligram a day. So what are some of the side effects that you want to look out for while you're on this medication? So common side effects include low blood pressure. So like I said, this medication is used to treat hypertension, but we don't want a severely low blood pressure in this patient. So usually what happens is you want to make sure that you're checking your blood pressure while you're on this medication. If you start feeling certain side effects that are not normal, make sure that you're checking your blood pressure and making sure your blood pressure is within the range. You want your blood pressure lower than 130/80 in most of our patients. Some patients, their criteria is 120/80. So just depending on where you stand in the class of hypertension that you have, then you want to make sure that you're taking the the right caution when you start seeing your blood pressure in the abnormal level or valued areas. All right, so what are some other side effects? So some other side effect includes something a condition called reflex tachycardia, which is an increased heart rate due to a lower blood pressure. All right, so another side effect is headache as well as fluid retention. This medication can also cause diarrhea as well as anorexia in some of our patients. It can cause loss of appetite as well as chest pain. So usually the chest pain is categorized as something called angina. So usually patients will have to stop the medication if they start having these side effects. So what are some other serious side effects that you want to make sure that you're reaching out to your doctor for immediately? So a common side effect of this medication, or a common serious side effect that they've noticed in patients taking this medication, is drug-induced lupus. So patients usually have this serious side effect, and they will normally have to stop the medication if this happens. Also, it can cause an increased irregular heart rate. If you start noticing this, make sure that you're raising concerns to your physician or your healthcare provider. That way they can see or monitor you and see if you need to switch to another treatment, or they're just going to have you stay on that treatment and just continually monitor you while you're on the medication. It can cause low blood pressure, like I said, hypertension, but when it becomes consistent, you want to make sure you're reaching out to your physician. Also, this medication can cause lower potassium levels. So this is something that your doctor will probably notice when doing your blood work. So you don't want to miss those appointments where your blood work is, done. And, we're able to check for different minerals and electrolytes in your body to make sure that they're not being decreased or depleted while you're on this medication. Also, the medication can cause fluid retention, like I said earlier. So make sure that you don't want to stay on this medication for too long. That way it doesn't, cause like swollen leg or swollen lower extremities in this patient consistently. All right, so this medication is usually taken with food or milk in order to help increase the blood levels of the medication. So taking the medication with meals actually help in terms of how much of the drug is getting into the blood, and helping in terms of lowering the blood pressure in patient. Also, this medication, you don't want to double your dose. If it's closer to the time of your next dose, make sure you skip that dose and just continually take it as prescribed. Like I said, this medication is a 3 times to 4 times a day dosing, so it's kind of hard to just completely go a day without taking the medication. All right, so this medication, like I said, it can cause headache or palpitation in the very first few days of taking the medication. So if this does happen, and it's, you know, it continuously happen even after a couple of days, maybe like a week or 2 weeks, you want to make sure that you're reaching out to your doctor to see if there's other therapies that your body is going to better tolerate while treating your high blood pressure when you're on this medication. Also, you want to avoid driving while you're on this medication, just in case if the medication does cause dizziness. This can kind of affect your mental alertness, so that's why you want to avoid driving or doing any activity that requires for you to be mentally alert while you're on this medication. Also, with this medication, you want to make sure that you're avoiding decongestant, cold medicine. In general, we don't prefer taking decongestants such as pseudoephedrine or phenylephrine in patients who have high blood pressure, because these decongestant can increase the blood pressure. So you don't want to be taking a medication that's increasing your blood pressure in addition to another medication that's supposed to be decreasing your blood pressure. You just kind of counteract each other, and this is not really good for your heart or your blood vessels. So you want to make sure that you're aware of this. When you have a cold, try to take there's a medication called Coricidin, HBP, which is a preferred medication in patients who have a cold that also have a history of high blood pressure. So I hope I was able to help you in terms of what to look out for while taking this medication. If you have any concerns, be sure to comment down below and we'll try to answer your questions as soon as we can. Also, in order to talk to a healthcare provider, you can check out our channel at www.damiarxcare.com in order to talk to a healthcare provider regarding your therapy or treatments if you have any questions or concerns. I hope I was able to help in terms of what to look out for. Once more, please make sure, if you haven't done so, hit the like and subscribe button down below. That way you're able to help support our community here and also get alerts anytime we post our other videos here on YouTube. Thank you and stay tuned.